TMS. With fMRI, we can monitor brain activity, but passive monitoring is just one way we understand how things work. To work out how a system works, we often want to manipulate it too. We've already talked about lesions. That's quite useful. If a psychological function is abolished after a brain area is damaged, we know that this area is essential. That is, it is causally irreplaceable by other existing brain circuits. This is not always true for all brain regions showing bold activations in fMRI. Just because an area is involved and shows neural activity doesn't mean that such involvement is causally irreplaceable. Now, in biology, we say that this is because of the phenomenon of degeneracy, which states that multiple mechanisms may exist to serve the same function. These mechanisms are unlikely to be identical, but given a context, they may contribute to the same function in similar ways. This gives the impression that there is redundancy. So it would be quite useful to have a tool to manipulate or disrupt brain activity, without having to wait for a rare patient to show the specific brain damage in the area that we are interested in. Obviously, we can't just damage people's brains.
Why did you hit yourself on the head for?
I like it, I like it.
Also, naturally occurring brain lesions may be large and not just restricted to the area we want. And patients with brain damage may be quite impaired so that we can't test them right away. While we wait, the effects of brain damage may change. Transcranial magnetic stimulation is a useful tool to manipulate brain activity non-invasively. That is, with minimal damage to the brain tissues and without having to open up the skull. Recall that neurons are electro-chemical signaling devices because a magnetic field can influence electric currents by inducing it near neurons. Zap! It can cause neurons to fire. So if we place a coil of wire on the scalp and pass electric current through the coil, we can induce a transient magnetic field, which would cause the neurons close to it to fire. If we place the coil, say in the back of the head, where we know it is important for visual information to enter the brain, when we send the magnetic pulse, we can cause people to see a blob of light that doesn't really exist in reality. We call these induced phosphenes. If we place the coil somewhere else near the brain regions important for motor control, we can even make people's hand twitch involuntarily. So, there are two kinds of TMS that we can do: online or offline. In online or concurrent TMS, we send these pulses to a targeted brain area while the subjects are doing certain tasks. For example, we can make them watch some visual figures and report what they see. Then we test if TMS to certain brain areas may impair their performance in those tasks. Often, we just send a single pulse, but to maximize the chance of getting an effect, we can also send a train of repetitive pulses, like 5 pulses at 10 Hz. That would last for around half a second. This technique is called repetitive TMS, or rTMS. There are strict safety guidelines as to how fast and how many pulses one can send, because at high frequency and intensity, there is the danger of inducing seizures. Single pulse TMS, though, is generally very safe. Additionally, with single pulse, you can also know precisely when the neural activity is most important. That is, we have very high temporal resolution there. But sometimes, like in lesion, we do not care so much about the precise temporal resolution. Instead, we may just want to know if a region is important for a task. So one can also send a larger number of pulses before the subject performs those tasks. This is offline TMS. We can stimulate a region at 1 Hz for, let's say, 10 minutes. This can affect the brain region for a while. In fact, there are specific pulse sequences one can send, such as a theta burst, which is a train of gamma pulses 50 Hz, modulated by a slower frequency, theta, around 5 Hz. These specific sequences are chosen because they are known to lead to longer lasting effects. With theta bursts, for instance, stimulation of a minute can lead to effects that last for up to an hour. In this case, it is a bit like giving a drug to a subject before we ask them to do psychological tasks. Except now, we know the effect should be targeted for a brain region. So what is the spatial resolution of TMS? Usually, we're talking about resolution on the order of centimeters. If we position the coil carefully, for example in the motor cortex, we can make people twitch one hand muscle without their whole arm being stimulated. So it's fairly focal.